Hurst.
Hi, Asad, how are you doing?
Yeah, I'm good, how are you?
Yeah, very well, thank you.
Take a seat.
Yeah, thanks.
Dr. Hurst, would you mind introducing yourself for those watching?
Yeah, I'm Dominic Hurst. I'm a senior clinical lecturer here at QM. I've been here since 2008.
And whereabouts did you grow up?
Well, I was born in Oxford, but then when I was 2 or 3, we moved to Kenya. So I lived in Kenya for 6 years as a small child. And then we came back when I was 9, and we lived in Beaconsfield in Buckinghamshire, which is very posh and la-di-da, but just outside the M25, and that's where I grew up.
Okay. And
what were you like at school?
What was I like at school? Well, I was very shy. I was a very shy child, very introvert, and actually I hated school, to be honest with you. I really didn't like school at all. Wasn't particularly academic, struggled throughout, I have to say. When I got onto A-levels and all that kind of stuff, I had to resit because I got rubbish grades and so on. So I struggled at school. It was okay, but I just didn't particularly enjoy it.
okay.
So you say you struggled at school a bit, and you think in retrospect that was down to dyslexia. So can you talk to me a bit more about your kind of work with dyslexia and how it's impacted your life?
Yeah, I really did struggle at school. I actually only discovered I was dyslexic about 2 or 3 years ago now. I've just finished and passed my DPhil at Oxford.
Congratulations.
Thank you. And it was during that time actually, because obviously for a PhD you have to do a lot of reading. I was struggling to keep up. My supervisor was saying, "You're not keeping up, you're not reading enough." And so I actually got tested for dyslexia at Oxford, and was found to be dyslexic. And it just explains, as I think a lot of people who get a diagnosis, and particularly later on, it just explains an awful lot of why stuff was so difficult so much further back. And I have to say, after finishing dental school, I never sat another exam because I just absolutely hated exams. I really struggled with them. So I've never done the fellowship at the Royal Colleges or anything like that because I just thought, no, not really. Fortunately, like with the MSc that I did at Oxford, it was all assignments, and that's much easier to do when you're a slow reader and you can't remember stuff or whatever. And got distinction in that, and then I've just, as I said, I've just done the PhD. So that kind of stuff where you've got a bit more time to write and to think and so on is fine. But exams are just a bug.
And where do you study dentistry?
I went to dental school here.
Yeah, the best.
The best ever. It was called the London Hospital, Royal London Dental Hospital, Royal Dental School, whatever it was anyway, at Queen Mary. So it was before we actually fused with Barts. That happened about my 2nd year, I think, when I was here.
Okay.
And as you probably know, I was based in that awful building over there, where the lifts didn't work and nothing. It was just a bit of a dive, really. You guys don't realise how nice it is here.
So obviously we're quite lucky, and we don't really realise how lucky we are to be in there.
Don't all old people say that? To all young people.
How
does it differ in terms of teaching from back then to now?
I think one of the most significant ways is that we never had outreach clinics. So now you guys have 3 outreach clinics that you can go to, but we never had that opportunity. And the key thing about that is that those are primary care settings, whereas the dental hospital is a tertiary care setting. So for patients who come into the dental hospital, they have to be referred in, and they get referred to a consultant. So a consultant devises a treatment plan, and then you as a student are pretty much obliged to follow it. Now, to some degree, there's some variation and so on. But in the outreach clinics, because it's primary care, it's like as if you're working in general dental practice. If you're the patient seeing that, if you're the student seeing that patient for the first time, you are the first person that person's had contact with in the institute. And so you end up doing all the clinical diagnoses, you determine what radiographs to take in consultation obviously with staff, treatment plan, and all that kind of stuff. And I think that's a really valuable experience. I do get the sense that students don't quite value it as much as I think they could value it, because unfortunately we sort of value things like how many crowns have you done, how many root canal treatments have you done, how many of these have you done, whereas actually the basis of all dentistry is a correct diagnosis.
Yeah.
And so, and it's a real weakness that people still seem to have, even as they're qualifying, that actually diagnosis and treatment planning is not quite as good as necessarily their technical skills are.
Yeah.
So I think it's a really valuable experience that we never had.
Yeah, no, definitely. I think it's an amazing way to learn. Like you're saying, it's really good because then you get the holistic kind of learning experience.
Absolutely.
So from kind of graduation, I assume you went out into general practice, and I'm interested to know how you went from kind of maybe the high street dentist to where you are now as a senior lecturer.
Between qualifying and getting back here. So I qualified in 1999, and we didn't have the same sort of foundation training organisation that you have now. I actually had a year, you used to just sort of identify a practice and that was a training practice, and you approach them and say, do you mind if I join your practice as a trainee? I had to admit I found that very stressful in the last year, and so by pure luck, my brother-in-law had just bought a private dental practice, and the associate who'd been there had left, and he said, well, why don't you come and work with me for a year? So I did. So I went and worked as a private dentist for that first year, and then I did vocational training with him actually, the second year, which was very cushy, and then the third year I was still there. But I have to say, during that period I actually had 2 complaints made against me. So in my first year, both of which were thrown out by the GDC, both went to the GDC and both were thrown out, but they knocked my confidence hugely. And I think a lot of you guys will encounter this out there, and it's really important that there's support and so on for people when they do get complaints come in, because they will come. There wasn't support in my case, and actually my mental health deteriorated massively. So at the end, after about 3 years, I actually had pretty much a mental breakdown and quit dentistry for 2.5 years. And during that period, I kind of just messed around and did odd jobs and whatever. But my girlfriend then, my wife now, said to me at some point, well, Dawn, don't you think you could be earning a little bit more if you went back and did dentistry rather than doing hourly jobs at £8 an hour? So I did actually come back to the dental school, and I spoke to a professor who was around there, Professor Ray Croucher, who's in dental public health, and I'd kind of known as an undergraduate, and asked if there were opportunities for me to get involved in teaching and so on. Funnily enough, the first thing he asked me to get involved with was doing some critical appraisal teaching. It was unpaid, like a lot of, when people come in initially, even now, people often will volunteer and do stuff just to get the experience and so on. And then around that same time, they were also starting up a community project on a mobile dental unit in Tower Hamlets, and so they were looking for a dentist to kind of set up the clinical aspects of that, and equip the dental surgery, the mobile dental unit and so on, and then be a dentist on it. So I equipped the unit, and I was doing that for 2 or 3 days a week for about 3 years or so. So that was with Tower Hamlets Community Dental Service back then, Primary Care Trust, whatever it was. And then I did some more work for them, less so on the mobile dental unit, more of some of their fixed clinics, running their emergency clinics and so on. And then eventually in 2008, I got the job here to be a clinical lecturer based out of Barkentine almost all the time. Okay. So now I'm only out there 1 day a week, but when I first started I was pretty much out there all the time with one other colleague, so there were just 2 of us running that clinic. Yeah. Okay. And now I'm 11 years on.
Full-time lecturer. Thank you very much. So now I'm quite interested to know about your kind of work in destigmatizing mental health and also the Dental Health Support Trust.
Dentist Health Support Trust, yeah.
So,
What about? Yeah, so as I mentioned earlier on, I've had my own mental health issues since probably actually when I was an undergraduate dental student. As I understand it, about 3/4 of mental health or mental ill health, I should say, starts in people's teens actually. Oh. So it's not unusual that it starts early in that sense. But yeah, so essentially throughout my adult life I've had mental health issues, problems, and have dealt with it better or worse at different periods. But because of that, I'm and because of having got better to some degree over the years, I'm very keen to get rid of the stigma of mental health.
Yeah.
Because one of the biggest problems is that people feel embarrassed to talk about having mental health. And so as a senior member of staff, I feel that it's appropriate that I should say I've got mental health, I've had mental health problems and so on, just so that anybody younger or less experienced can see that it's okay. You can still do okay. You can still get places and function okay. You know, it's not like you're going to be totally lampooned or anything. So that's one thing. And then also just with the Student Support Office and Dr. Berry and others, helping to support students who have also got difficulties, and trying to be sympathetic and empathetic to them as they're struggling with similar stuff to what I was struggling with, but also very different stuff to what I've had to experience. The Dentists Health Support Trust is a charity that I'm involved with now, which is run primarily for when people are qualified, although we have had 1 or 2 students who've actually spoken to them as well. And that trust helps people with alcohol and drug addiction problems and general mental health issues, particularly where they're affecting, not only though, but particularly where they're affecting their practice. So they'll help with providing therapeutic services, they'll help advise on when people get into difficulties with the GDC or whatever as well. And so they're a great charity and they do a lot of really good work for dentists.
Thank you very much. And I think the students really appreciate when kind of a member staff is quite open about that, because you're right, it does show like you can get places even with mental health issues. And you were saying that 3 out of 4 mental health cases start in their teens, and obviously we've some people have just left the teens, so it's really important to catch it at the early stage.
Thank you very much, Dr. Hurst. Thank you for your time today. And thank you to all of you watching. You can follow us on Instagram if you'd like more, at Barts London DentSoc. And you can also like us on Facebook, Barts DentSoc. And please feel free to subscribe to our YouTube channel. Thank you very much.